Hi, my name is Manuel Corpas. I'm a senior lecturer in genomics from the University of Westminster, and I'm very happy to give you a little bit of a taster of the presentation I had the opportunity to give at PHURI, Queen Mary University of London, on the 11th of December 2024. And it has to do with the analysis that we've performed with Inca descendant peoples from Latin America, specifically from Peru. And every time I give these kind of presentations, I have very strong statements that I want to communicate. And it's this idea that for us to be able to perform this kind of research, it's very important to fully respect the traditions and the peoples of indigenous populations. And my work acknowledges the cultural significance and their heritage, as well as the fact that I do strive to honor their legacy and ensure that my research upholds their dignity and respect owed to their descendants. I do condemn genetic colonialism because I do not accept that the benefit sharing has to be done without the people. There's quite an interesting saying from the traditional Australian Aboriginals that, no decisions without our representation. And so we want to improve their representation and we want to keep them as part of whatever benefits this research can perform. And then finally, also to say that we really need to build trust in science, that as scientists, we can't assume that people are going to trust the work we do. And you may think from the point of view of London, why is it so important to even think about Latin American genomics? Well, as it happens, the Latin American diaspora in London has increased 400% in the past 2 decades. And even though they are no longer invisible, as this report from Queen Mary University of London states, they are a lot more likely to suffer from discrimination in terms of the wages that they have, in terms of the illnesses and so on. But we have at Queen Mary University of London a great precedent of research that has been carried out to improve representation of populations which are not so well represented in genomic data sets such as the Pakistani and Bangladeshi British diaspora. So we're trying to do a little bit of contribution from the point of view of Latin America, making sure that we put Latin America at the center of medical genomics at a global scale. And because London is a microcosmos of the world, there's no other place than this to really share our results. So I invite you to have a look at the presentation that I gave, and I look forward to hearing from you. So thank you for listening.